My name is Kent Osborne. I'm the director of the Dan L. Duncan Cancer Center at Baylor College of Medicine in Houston, and I'm one of the 3 co-directors of the San Antonio Breast Cancer Symposium. The meeting is divided up into educational sessions in which we'll cover all the major areas of breast cancer. There's going to be one on breast cancer prevention. There's going to be one on HER2-positive breast cancer, on triple-negative breast cancer, on survivorship issues and how to control some of the symptoms that women have going through treatment or after treatment. So we cover almost everything. And then there's mini symposia that are sort of small, more thematic meetings that are going to cover several areas like immunotherapy of breast cancer, which is a brand new area that we're just learning about. It's been proven to be effective in certain other tumors. It's just getting started in breast cancer. So that'll be a major part of our conference this year. And then we have about 45 oral presentations of abstracts that are submitted. We get about 1,600 or 1,700 abstracts that are submitted. We pick the top 40 or 45 of those for oral presentation. And those range all over the map, from very basic science to results of major clinical trials, for instance, that everybody's waiting for, to translational science. When I was a young investigator back in the early 70s, I saw what was going on in breast cancer. They had just identified the estrogen receptor, and were new drugs that were targeting that. And that really got me interested in breast cancer as a disease to study. And I think when young investigators come to hear all the different things that are going on in the breast cancer space, they're likely to be turned on by a certain area or a certain group of studies that they want to then carry out for their career. And we learn by hearing what other people are doing, provide clues to what you're doing that you might do it better, or a new idea that you might have and integrate into your own science, your own research. So this kind of communication is extremely important for scientists. The AACR has been a major leader in putting together not only this meeting, but many other smaller meetings that are more focused on certain areas of cancer research. And I've done a great job in linking the clinician investigator who does the clinical trials with the basic science investigator, something that the San Antonio Breast Cancer Symposium has also tried to do from the very beginning. We've wanted to link and teach clinicians about basic science and basic scientists about the clinical issues, because that's how you make progress, is having these 2 groups use their expertise working together to make advances that will eventually help patients.